mother. Today we're looking at life after childbirth, postpartum health. What are the complications that come with it? What happens to the mental health of the woman? What happens to the physical health of the woman that brought this child into the world? We're having this conversation with a midwife educator in St. Luke's College of Nursing Sciences, Wusasa, Zaria, Mrs. Pauline Ibiemi Ennis. Thank you very much for joining us on the show today.
You're welcome. Good afternoon.
Afternoon, ma'am. How are you? How is Zaria this afternoon?
Zaria is fine and calm.
Oh, beautiful. How's the weather?
The weather is conducive.
All right, that's great. Let's get into it. First off, you're a midwife educator. And I really want to ask, what inspired you, to becoming a midwife educator?
Okay. Actually, I was a midwife at my first qualification. Then I did my nursing. I went for my public health nursing. I'm a pediatric nurse, and I went for tutorial nursing in Kaduna Polytechnic. And so that qualifies me to be either a nurse tutor or a midwife tutor in Kaduna Poly. And I decided to be under the midwifery as a midwife educator. That is how it goes. You must be qualified as a nurse or as a midwife before you can go for either any of these choice.
That's pretty interesting. The aspect of midwifery has always caught my attention. Well, before this generation, would you agree that there were more women that were accustomed to the ways of midwifery than we have today?
Yes. Actually, even before the existence of this century, we have women who take delivery in the communities, and we call them traditional birth attendants. Such women are known in their environment. They are popular and they are legally known that they don't have any atrocities, and so the women rely on them to deliver them in that community. And so many of them does not really go to the hospitals because they have confidence at these women. They know how to maneuver deliveries and they will give birth successfully. So that was what was existing until the education came in that women should be trained, ladies should be trained as to know how to reduce the mortality rate that exists. That is the extent of this midwifery school.
All right, so that sounds very interesting actually. Can you walk us through the typical journey of a woman receiving prenatal care and then giving birth with the support of a midwife? What is it usually like?
Actually, pregnancy is a good thing when a woman goes through that stage and goes under a trained midwife who supervises her, educates her on the nutrition, the balance between herself and the husband, the physical environment, the love that the environment gives unto her, leads her throughout the pregnancy to avoid any complication that may arise during delivery or after delivery. That is the prenatal care. And so such women are advised, especially for the first delivery, and when you have gotten much deliveries, they are the people at risk, that they must be present, in antenatal to supervise them for so many complications that we may mention later during this discussion.
Okay, now you mentioned that there are certain individuals that have to be present through the journey of the pregnancy. So that means it's not just the carrier of the child that has to, be a part of the journey of bringing the child, forth. How is the response to this? Do you have a lot of, men coming to say, oh, I'm going to be a part of the journey, the prenatal journey of my partner?
Yes, the love that the spouse shows during pregnancy assists the baby to grow well, help the woman to go into labor successfully. If a woman will want to come to antenatal clinic and the husband decides to say, okay, let's go together. Oh, what a beautiful thing. It's a beautiful world for that woman. And then when the woman goes into labor, the woman is there and her husband decides to say, I want to watch the delivery. It is allowed, medically allowed, for the legal husband to assist even the woman in labor. And so during the delivery, the man is present there to see what the woman goes through. And so that you now know the value of what this woman does in delivery rooms.
How does that benefit the woman? You know, the presence of her partner in the labor room, how does it benefit her?
It helps the woman to be able to assist the midwife to push at the right time. Because the husband will be there to help, even to elevate her head, so that when she's pushing, she will not push through her neck. She will push down as if she's passing a heart tube. The husband is there to show the love and to the care that the man has for the woman at that time.
Well, that's such an interesting thing. You know, a lot of people will think that, myself inclusive, will think that, you know, it's the woman's responsibility. It's, you know, it's on the woman most of the work. And now we're seeing that even the man is a very strong factor. You know, he plays a very strong role in the birth of a child. Now let's talk about what happens after the delivery. Before we came on air, we were having a little chat, and you mentioned that if we begin to talk about the challenges women face after, or the kind of complications that women could face after delivery, we'll not finish it in one session. So let's get into it a little bit. What are some of these complications? What could they be, from the most common to the rarest?
Okay, it is not every delivery that leads to complication, but there are some complications that are not predictable, and there are some instant complications that arise, especially bleeding. When a woman is in labor, the existence of making that we have the first stage of labor, the second stage of labor, which is the delivery of the baby, the third stage, which is the delivery of the placenta. Development has come up that we have the fourth stage of labor. That is what to do to prevent this woman from bleeding after the delivery of the placenta. And so the midwife have been trained to prepare for the fourth stage of delivery, making sure that there's availability of injections, availability of fluid, as to resuscitate this woman to reduce the mortality rate of these women. That is the first thing. Then there are other cases that does not occur immediately after delivery. In such cases, there are some complications that arise, like blood pressure getting high, or a woman with diabetes going to pregnancy and coming out of delivery. There are some cases we have infection. If a woman delivers and the midwife is careless as to leave the pad in the vagina of this woman, it is so dangerous that 2 weeks after, this woman will not be healthy. That's why they develop high temperature, there's a foul smelling, there's sepsis, and so the woman has to come back to complain. Then it is expedient that when a woman delivers, you don't go out of your health provider. You must be constant in coming, because she or he want to know your progress. Is there any problem that arose after your 7 days delivery, or 2 weeks after delivery, or 3 days after delivery? And so those things are, in some cases, 7 days after delivery, a woman developed depression.
What leads to this? Okay, go ahead.
In such cases, that patient or the woman supposed to be around her health care provider as to know the changes, the warning signs. Warning signs like you just decide to say, oh, I noticed that I don't like my baby again. I feel like killing myself. I feel like killing this baby. Please take this baby away from me. Such women are easily seen as developing a psychosis after delivery, which we call puerperal psychosis. It will also come as a depression, anxiety. And so this emotional phases of postpartum depression comes like anticipation. There's too much excitement. Maybe she's been looking for a baby, a male baby, and she has about 5 females, and the husband keep on troubling her. If you don't give me a male baby, I will sack you, I will divorce you. And so the male baby comes in. The excitement, the happiness, the fulfillment, and the frustration she has gone through makes this woman to go into depression. In some cases, the husband reject the woman in the hospital and said, I don't want female baby again. I am tired. And so you know the psychological feelings that this woman will have. Possibly this is a socialite. And so now the husband has disgraced her openly that she will not come and pick her after delivery home. Such cases could bring depression, sadness, guilt. So all this could start gradually during pregnancy and post-delivery, because the husband has assured her, if you don't give me a male child this time, I'm not going to love you again. I am not going to support this delivery until I hear that you have a male baby, then I will not come to the hospital. So that is all the contribution that leads to depression postpartum.
Well, that's pretty. That's a very pretty sad narrative. Now, you've mentioned a number of times that the sex of the gender of the child might be a leading cause of postpartum depression. When a woman when a woman finds herself gearing towards this postpartum depression, when she starts to develop these signs, what would you advise that should be done to get her out of it?
That is why I mentioned earlier that if a woman has such cases, she should not be far, not that the relatives making the woman to be far away from her health provider, because what she notices is she's feeling so sad, she's hopeless, she's guilty, she looks at herself worried excessively. She may even lose interest in herself. What she used to enjoy before, you just notice that she no longer gets interested in such things. And then her appetite changes, because if the mind is at rest, then the body too will be interested in the environment. And then she finds that she cannot sleep well. After delivery, a woman is expected to eat and sleep a little before baby wakes up to suck the breast. The way a woman will start crying unnecessarily, and then her thought is, I feel like killing myself. I feel like killing this baby. I don't want this baby. Lack of interest on the baby, that you expect a woman that delivers to be happy, to prepare for her naming ceremony, to look gorgeous on the naming ceremony. She starts telling you that I'm not interested, I am not going to celebrate anything. Then you begin to go close to this woman, make sure her health provider is available or around for her to check this woman.
All right, Ma. Now, we've heard of cases where women have already given birth, but they can't lactate, right? How often does this happen, and what causes it, and how can it be treated?
Do you know that depression can cause lack of lactation of the breast of a newly delivered woman?
Wow.
Because the mind is not at rest. And so the oxytocin that comes from the brain has to increase the secretion of the breast milk is not available, because the woman is depressed. She's not happy. And so it could also lead to lack of production of milk from the woman.
Okay.
Because of the oxytocin in the brain.
Okay. Is that the only cause, or are there other causes?
Yes, it could be medical.
All right.
There are some cases that medical reason, like mastitis, when the breast, when there's engorgement of the breast, or possibly like the nipple is inverted, it's not prominent for this baby to suck. It is the sucking reflex that brings about the milk that is produced from the brain down to the breast, where the breast accumulates in the breast tissue.
Okay.
So when there is no production of that milk because of the reflex action that is not available, the baby is the one that produces the reflex action. When he suck, then the reflexes begin to work. Then where the breast nipple is inverted, it is not prominent. And that is why we teach women, allow your husband to assist you to bring out the inverted nipple during pregnancy, so that when the husband assists her to bring out the nipple, after delivery, baby enjoys her breast.
Okay, that's interesting.
Where there's an infection of the breast nipple, it causes lack of production. because the baby cannot suck it. Where there is engorgement, the breast is so big, there's an infection of the breast, the baby cannot enjoy the breast. The woman will not even be ready to give the breast out. And then psychological feelings of this woman might not be able to allow her to even have, all I have mentioned earlier are physical,
yes,
or medical, but the psychological aspect of the woman life may not even produce breast milk.
Interesting. Now let's talk about self-care real quick. We don't have so much time left. Self-care. How can a new mother look out for herself? What are the things you would encourage, someone who has just gone through childbirth do to look out for herself physically and mentally as well?
Okay, the first one is the medical aspect of it. It is expected that after 3 days, the blood flow from her vagina should start reducing, making different color of reduction. And where such is not coming, then there's a problem. Then her physical body is that she should wake up in the morning and bath, the normal bath, where we have seen where women go for this Hausa method of wanka jego, that they bath very boiling water and they develop hypertension, they develop so many complications that you don't encourage such a thing now. But we appreciate the economy for that, because the economy does not allow it any longer. And so the method of saying you load a truck of firewood as to give your woman hot water to bath no longer exists, especially within us here in Zaria. And so such thing has reduced, because we notice that women will come for postpartum congestive cardiac failure because of the hotness of the water in their body. Their veins are dilated and they start breathing up, so many things that occur. But such things has been eradicated because of the economy. And then it's expected that when she baths in the morning, she should take her tea, take whatever thing she has at home to eat. The husband should also be in support. That's why we have maternal holiday now. There's no longer maternity alone, maternity leave. The paternal leave is also there to assist the woman. And so the baby is bathed in the morning, the mother too has her bath. And so they eat well. The nutrition of the mother matters a lot. She must eat nutritious diet as to help even her to secrete more fluid of breast milk.
Okay.
Then her environment should be conducive for her well-being. Then her families must support. The support of the family assists both the baby to grow, both the mother to eat well, both the breast milk to come, and the psychological feelings of this woman is filled up with joy.
So we're saying that positive emotions very important after childbirth for in the life of the mother.
Yes.
All right. Now we've heard you mentioned the wankan jego. That's the bath, the very hot water, scalding hot water bath that new moms are subjected to having. There's also this trend. I don't know if to call it a trend, but it's a practice where new moms have their stomachs tied with maybe wrappers or with elastic material or with girdles. They would say it's so that they lose the baby fat, the baby belly. Is this encouraged or is it just one of those practices that
culture? There's a limitation to how you can follow a woman with her culture. If her culture deserves it and she wants to reduce that is what we call subinvolution. You want the uterus to go back to its pre-pregnant state. That is, before she became pregnant, she had a flat tummy. And so for socialism, for social life, you want your tummy to go back to the pre-gravid or pre-pregnant state. Such women, they tie their tummy. But we also encourage that you can use towel to massage the tummy. It will still go back to a pre-pregnant state. The uterus will also go, because the more days you go, the more shrink the uterus becomes.
Okay. Okay, now let's talk about exercise. Exercising after childbirth. Lots of psychologists would suggest that women should exercise so that they could get out of, just in case they have signs of postpartum depression. But it hasn't been clearly stated how long after childbirth a woman is strong enough to return to exercise. So how long should a woman wait after childbirth before she goes, into exercising?
You see, when we try to copy what the Europeans are doing, it may not be applicable for us here. So the exercise depends on what do you want the woman to do. Squatting. To squat and get up, squat and get up. This one to also help to reduce the uterus to its pre-gravid state. That is the only exercise she's allowed to do if she doesn't have complication at delivery or after delivery. So can be squatting herself, bending and raising her head, her body up, coming down, raising her body up. It helps a lot to reduce the uterus from distending.
Okay. Are there situations where the uterus doesn't shrink back to its pre-pregnancy stage? Is that something that happens?
Yes, it's an infection. It's an evidence of there's an infection or sepsis.
Is it something that can be treated?
Yes, if it is detected earlier.
Okay. How do you know? What are the signs you see? How do you know that, you might have developed a sepsis and, quickly treat it?
Okay, like a woman tests you after 7 days and start running temperature. Without consulting your health provider, you say, she has malaria. You start treating malaria. And then you notice that even with the treatment of malaria, the body is still running. The temperature is still running. And such women will tell you that I have pains in my tummy. I have pains all over my tummy at the lower level, the lower part of my tummy. And then I notice that I have foul smelling odor from my vagina. So all these things will now make you to say, okay, let us go for consultation. You go to your health provider and they check your temperature is running. And then they now check your breathing. The breathing of that woman too will change. There's going to be alteration in the breathing pattern. And so all these things begin to worry the woman. She will not even be able to eat. She will not be able to breastfeed. She's not happy to herself. And so all these things will now make you to say, okay, let us go for a checkup. And then in some cases where the placenta did not come out, a midwife is expected to make sure you check the placenta and see the placenta and notice that there is no. Hello.
Yes, ma'am.
And so,
hello, are you with us? Hello.
Yes, hello.
Yes, you were talking about checking to confirm if the placenta is still in or has been expelled.
Yes. So where a midwife did not extract all the particles of the placenta, there's a retain a little, no matter very small alone, can cause infection the uterus. And then if the woman too had a tear at the cervical region, and the midwife you know, they might not be bleeding, but because of that tear, and so that's why you educate your woman to make sure she does this sit back. Sit back can locally be used with salt water, warm water. It doesn't have to be burning water. And so she sits inside this water in a bowl within the first 7 days, as to make sure that healing takes place. If at all she was caught during delivery, to assist the head of the baby to come out. And so all those things are part of causes of infection postpartum.
Okay. Thank you very much for your inputs, ma'am. This has been a very educating conversation. Just in closing, in about a minute, what do you have to say to young mothers out there and, people around them as regarding, I think we're having issues with the network. We're trying to reconnect with her and we're already running out of time. Sadly, would have to let her go without hearing her closing right there. This is my closing to you. Remember that every parent and every baby is super unique, and there's no one size fits all approach to navigating life after childbirth. So trust your instincts, be gentle with yourself, cherish the journey of parenthood, look out for your health, support your partners and your friends, and like our guest said, keep your healthcare provider close. Okay, don't push them away, keep them close so that they can always check up on you to be sure that your body is healing. Thank you very much, Mrs. Pauline BME Ennis. Very interesting conversation right there. I'm really glad that we still have lots of midwives, and we even have educators for them. We hope that more people learn more about midwifery. Let's not run out of them in the country. My name is Chinwe Blessing. Coming up will be the news at the world news at 6 p.m.